Welcome to the Software Process and Measurement Cast number 633. I'm Tom Cagley, your host today. The podcast features my interview with Unmesh Srivastava. We talked about organizational culture and disrupting healthcare through development that is customer-focused. We spent time discussing the need for empathy in order to find critical business needs. Unmesh points out that many times technologists think with their technology before they think with their hearts. Unmesh is the CTO at P3 Health Partners. Over the years, Unmesh and his teams have helped U.S. healthcare with opportunities to drive innovation and disruptive transformation using digital enablement. He has worked with multiple innovative organizations, building and deploying the next generation of healthcare. All the digital enablement projects have been geared towards driving a differentiated provider and patient experience while reducing the cost of healthcare and improving the quality of care. The technology products delivered by Unmesh and his teams range from clinical decision support technology for providers, data and artificial intelligence-enabled seamless care experience for patients, and multiple other innovations to drive down the administrative burden on the providers and health systems. Are you ready to talk disruption in healthcare? It's time for the interview. Unmesh Srivastava, welcome to the Software Process and Measurement Cast.
Thank you, Tom. How are you?
I am marvelous, and it's a great day. In where I live in the United States, it generally gets cloudy around Thanksgiving and stays cloudy until March. So today we're about to, it's in that general neighborhood, and it's a clear sky, and life is, at least inside, life is good.
That's great.
Let's dive in and start talking about the role of technology and healthcare and how intertwined those two things have become.
Yeah, so absolutely. I think technology plays a big piece or big role in healthcare today. There are innumerous aspects of technology that enables healthcare, be it the care delivery, be it the labs, pharmacies, hospitals, outpatient, inpatient, skilled nursing facilities, long-term acute care facilities, all of the care delivery as well as healthcare ecosystem is run by tech. This is probably the one area or one vertical which the technology has not completely disrupted how, things are and how the operations are run, which gives us techies in healthcare the opportunity of building big things, because this is yet to just, completely turn around things and completely change things in healthcare. So I think it plays a big role. Tech plays a big role in healthcare.
You talked about it not being totally disrupted. Why is healthcare less disrupted than like finance? We've had fintechs disrupting finance for a long time.
Yeah, I think big part of this is just all the compliance and regulations that are in healthcare, which even though you have the technology, but it's not very easy to implement because of all the regulations and compliance. And then just the impact on the overall lives of people. I mean, until a piece of technology is completely vetted out and is compliant and, is the best in class out there, which will have pretty much zero risk, anything up and down can lead to, lives going away or people dying. So I think that's why technology adoption has been slow in healthcare, but that doesn't mean that it cannot be fintech. I mean, there's absolutely with the tech, I think the technology in general has gone up quite a bit in terms of its complexities and what it can do. Now it's about how you actually bring it into the business processes in healthcare to enable them and use that technology efficiently in order to drive better patient care and reduce the cost of care, improve patient experience and provider experience.
In your knowledgeable opinion, is this tech looking for a way to find a solution, or should we be problem focused first?
Well, it has to be hands down. Anything that technologists do have to be problem focused. I think before you even think about the technology and the solution, you got to think about what problem you're solving for. And where does that problem, and you might have a gazillion problems, where does that problem sit in its impact to the vertical that you're building it for? So I think problem is where you start with, and the impact of that problem is where you start with before you build on, the solution and the technology and how you solve it.
Well, as a techie, how do you get clued in as to the problem versus stop focusing on, the things that are shiny and bright and that are, the technology side? How do you get out of that sort of that rut?
I think at least what I've learned in my career is a couple of things. The first thing is the voice of customer. So if you don't hear the voice of customer, you won't even know what you're solving for. And two is building empathy in everything you do, right? So you as a technologist have to sit in the shoes of the business operator or the clinician or the patient, or the insurance companies who are running these large operations to really understand what they're going through on a day-to-day basis and where there are inefficiencies and what the impact of those inefficiencies are. So voice of customer and, building empathy in your process leads you to identifying the right problems, and then the impact of those problems are very clear. I mean, you work with finance and you work with other aspects of the organization that can clearly help you identify what the impact of those problems are. And that's when you start picking out of the 100 problems, which are the top 2, which have the most impact on the business. Let me start by solving those 2 before I move on to the 100.
How did you learn that lesson?
I think these are life skills. I mean, ultimately, it's not technology or anything else. It's problem solving. To me, I think it's a life skill, right? Problem solving is a life skill. For problem solving, you need to understand what problem is. Solution might be technology. It might be technology plus business process. It might be technology plus business process plus people, right? So I think this is a basic of problem solving, which comes as you solve problems, you get to know what the fundamental is really sit in the shoes of people who are facing those problems so that you can first understand what that problem is before you go about building the solution.
When we're talking about something as complex as the whole vertical of medicine, I mean, it's one thing to, and that's complex too, like insurance. And both of us have spent a little time in the insurance market. Both of us probably have spent some time in the clinical side. I mean, those are so different and so intense. I mean, there's just a lot to learn. Is that, obviously someone can get some surface level experience and see it. They go to the doctor and they fill out forms. So they might feel like they have depth in terms of understanding the target market. Is that absolutely required?
So I think that's a really good question, Tom. And I agree with you. Healthcare is vast. Care delivery is vast. Health insurance is vast. Pharmacy, labs, they have deep operations and humanly impossible to learn all of that. I think that's where, personally, in my experience, that's where you forge partnerships across organization. You build partnerships with the right business leaders, with the right technology leaders, with finance, and try to bring them all together and say, okay, here are your top problems. Bring the finance in and say, okay, well, what is the impact of this problems financially? Bring in the operators in and say, hey, how does this impact you? I think you got to connect those pieces to really understand. A lot of us, like, especially the technologists, spend too much time on, hey, this is the new shining tech. Here's where I start with. Here's the magnanimity of how this, how big this solution is going to be, and all of that. And in that process, we forget what the problem is. I personally feel bring more people on the table and quantify the problem together. Humanly, you can't go work in all those departments and learn. But if you bring the right partnerships together on the table, you can definitely identify what are your top 3, 5 things in the organization you need to solve for. And you take that in broader healthcare, it's the same thing. You bring the right people in, the right organizations. I mean, if you think broadly from a healthcare perspective, we all know that healthcare cost is a big issue. Medical costs in this country are skyrocketed. They are way too high. The clinical outcomes are not that great. The quality of care which is provided is not that great. The patient experience, actually, with the process of how we built healthcare in this country, patient, even though we've said that patient is the consumer, but patient is the last person that these large health systems and these care delivery and big insurance providers actually think about. So how do you bring patients at the center of everything? And patient experience has to be one of the big goals to improve. And same goes with provider experience. I mean, there's provider abrasion. 40% of the entire provider networks are burnt out because there aren't enough medical providers out there. How do you make their lives easier? So I think there's no dearth of problem. And I'm talking specifically about healthcare and healthcare digital. There's enough problems that you can see on the surface, and which are, if you go on the web, you can find everything about them, which is your starting point. And then you bring the right people on the table to really go in deep detail on one of these high impact problems to really understand everything about it before you start building out the solution.
So when did you recognize that building these partnerships with stakeholders was, and I'd almost say, up front, we talked about empathy and the voice of the customer, but I would say building bridges and partnerships sounds like it probably is just as important as either of those two things. Mm-hmm. When did you realize that?
Very early in life. I think I was born and brought up in India, which is a country of 1.4 billion people, and it's a collectivist country. So it's always a we versus a I. So a lot of things that happen in your life or where you are facing the challenges, you've got to get, the family comes together and the friends come together and they consider it as their problem, right? So I think that there's a cultural or human aspect of it. But I feel that on the corporate side, more professional side, it's not about you. Right? Because the people who will be sitting on the table, these stakeholders, all have a stake in that problem. So you are seeing it from your lens, but the finance is seeing it from their lens. I mean, their P&L is taking a hit because the medical costs are high, right? The clinicians are taking it, they have their side of the problem. So these big problems actually impact the entire ecosystem. So they all have a stake in it. And that's how you bring them all together. They all have vested interest in solving that problem, but someone has to take the leadership and sit at the center of the table and start connecting those pieces together on how this one problem impacts everything. And once you have a shared partnership in solving that problem, which means it's a big problem because it impacts everything, is when you get everyone on your team. It's going to be one team that is working on resolving one issue.
Do you see that as being something that can happen within some of these larger organizations, or is that something that has to cross-cut them and be driven from outside?
That's a great question, Tom. I think it depends. There's a lot of things involved in this because I've usually worked with the senior executives in my career very closely with the CEOs who are running the organization. It really depends. There are a lot of internal factors about that organization and the impact of the problem that will really drive whether you look inside or you look outside. I'll give you an example. when I was at United Health Group for 6 years in the Optum Care business, I was leading this team called Innovation and Business Transformation. And we were considered as a change agent directly reporting to the CEO, where our job was really to identify the problems more than the solutions. Our job was go around and integrate with other parts of other departments and get them all together and define the big problems that you need to solve for, and then come up with a collaborative solution, which a lot of times the people who are running the business operations and the technology operations and the clinicians, they are so involved in their day-to-day that they cannot take their head out. And sometimes they have blinders and they're looking at it from one perspective. Sometimes building another perspective is important. So there, we built this external team called Innovation and Transformation, which would look at these problems with an outside lens. And we would bring in external subject matter experts and problem solvers when needed. But a lot of time just standing out of the day-to-day gave us a great perspective on the impact of the problem and how to best resolve it.
Slightly off topic, but as important, at least to me. You mentioned the term collaboration. How do you define collaboration?
As simple as the word sounds, I think there's a lot of depth to it. I think when you get a group of people together for a common cause, where they are all working hand in hand to solve for that one common cause or for that one problem or multiple problems, where they work together, is how I define collaboration. But that again is my definition. This is a deep word. Sometimes we feel that these are simple terms, but
no, not even close. Yeah.
Not even close, exactly. But that's my definition. In my career, collaboration has always been, how do you bring together the right people who have stake in the issue or in what you're solving for, and have them work together to resolve it.
You're deeply involved with P3 Health Partners. How does P3 actually make that kind of partnership and deliver solutions? Is that the magic sauce that you've just described?
Yes. So P3 means people, passion, and purpose, right? So the first P is people, which I think is super critical to us. So the business that we are in is we serve large populations. We are a population health management organization. So we take downward risk delegation from health plans, and we manage large populations. And the way we do it is through our people, process, and technology. So we bring the right technology and the clinical intelligence and provide it to the doctors at the point of care. And we've built a connected technology ecosystem that helps them drive efficiencies in patient care. And the doctors who work with us, we provide them with stellar physician experience by helping them reduce these administrative burden. So there's a lot of pieces that we've brought together with the P3, which is people, process, and tech. And we've built a technology-enabled care delivery ecosystem, which ultimately impacts populations and provides them better care.
Who is it that you're serving? Is it the organizations that bring this in? Is it the clinicians? Is it the patients? Who's the chief stakeholder there?
For me, my key clients are the health plans, because health plans reach out to us and say, hey, can you manage these seniors for us in this geography through your network of doctors and your services? So that is one of my clients. The other client I have is the doctors, because we very small network of doctors are employed by us. Most of the doctors and care delivery network is employed with us. So they are one of our customers, where we say that we are going to provide you with best-in-class data at the point of care, risk-based algorithms, risk-based data, better care management so you can send your high priority, high risk patients to us so we can manage them. We'll give you the infrastructure for telehealth, for data enablement, for remote patient monitoring, all of that so you can better manage these populations. So my other customer is the doctor. The third customer I have, which I think is the most critical one, is the patients. So yes, I've received, the health plan has told me, go manage these 10,000 patients in this small rural geography in say, Arizona. I've got a network of doctors to manage this population, but the end, who we need to manage is the patient. So all of the technology, the processes we've built, and everything that we do is centralized around the patient. How do we give them their data? How do we make sure that they are seen every quarter, every month in their doctor's office if they're a high-risk patient? If they're really, really high risk, how do I make sure that I'm having a regular telehealth line going between them and a care manager who I assign to them? How do I give them wearable technology? If they're a diabetic, how do I give them a glucometer and do a continuous blood glucose monitoring while they're at home to really identify if they have spikes in their blood glucose levels? So that to me is our third customer. So consider us like an Amazon that sits in between the providers and the customers and the suppliers. If you use the same analogy, we are something like that. We are an experience layer that sits in between and drives a great interaction between the three.
How did you decide to make this a business and get to where you are? I'm sure my listeners are saying, okay, today I may be a department manager as a coder. How do I get there? What is it that caused you to go down this path? Because you started as a technologist and may still even consider yourself one.
Yeah, no, I am a technologist. I am technologist at the core. I think what helps me is understanding of the business, right? I think what the differentiator for me has been is keeping myself in the shoes of the business people and the people, the clinicians, the patients, to really drive the right technology solutions. So I think one of the things that anyone can do, or your listeners can do, people who are managers, who are software developers, who are DBAs, to move to the next level in their career, is really finding that right problem to solve. And there will always be problems in any organization you work for. Or if you're an entrepreneur, there will always be bigger problems to solve, which will have growth opportunity for your organization. So I know we've talked about this in since we started, this interaction, is finding the right problem. Don't start with the solution. If you're a DBA in the organization, I would challenge you that find a way to, one, understand how your data actually impacts your end customers, and two, how can you make it better by improving, and where are the gaps with the end customers? Are they getting the right data? And I think then you bring it back to how can you improve what you are doing and solve one issue that will have a direct impact on them. And as you keep solving problems and forging partnerships and collaborations, you keep moving up and you keep doing better.
If you woke up tomorrow morning and someone handed you whatever your caffeinated beverage of choice in the morning is, and a magic wand, and said that you had the power to change any two things in how healthcare, that entire chain, which we've all both just agreed is enormous, is delivered, what two things would you change and why?
That's a very heavy question, Tom. I should have prepared for this, but that's the beauty of this conversation. So I'll give it a try because I, on a day-to-day basis, have seen so many issues that we have in healthcare. The first thing that I'm going to do is drive, and I'm talking from a tech perspective here. The first thing that I'm going to solve for is make the entire healthcare system interoperable, which means that the data should flow between different entities back and forth seamlessly with no walls, no, everything sort of working in tandem where the information flow is seamless between the entire ecosystem, be it the health insurance, be it your primary care, be it the specialist, be it the SNFs, labs, pharmacies, all of that. That's going to be one thing that I'm going to solve for. And the second thing I'm going to solve for is give the power of healthcare decision making and data ownership and experience in the hand of patients. So I'm going to completely change the patient experience and pretty much guide all of my healthcare ecosystem in the country or in the world to say, start thinking patients first instead of thinking insurance, instead of thinking I need to fill out the EMR. And then, obviously they can think all about it, but then build a solution or an array of solutions that's centered to patient experience and patient ownership in their care. So those are the two things that I do. I would have appreciated if you gave me like 10 options, but but let's say these are the two you gave, so I'm going to go about these two.
Is patient experience the disruption point, do you think?
Absolutely. Absolutely. I think that's where if you see this big tech going into healthcare, Amazon building Haven, with the three-way partnership, there's a lot of movement in healthcare. Apple going into Apple Health, building out the patient data interoperability platform. I think this is one thing which is a known fact with people who have worked in healthcare, operations, clinical tech, is patient experience. And just like, to me, it's like consumer experience. The consumer experience drove this multi-trillion-dollar business of, Amazon or Uber. They changed the entire experience of how you shop for things or how you take a ride to the next city. And I think that's what needs to happen in healthcare as well. How do you give access to patient care and multiple other things and just drive better patient experience across the board is going to change the spectrum of healthcare.
Yes. How would people continue the conversation or find you or reach out to you, those sorts of things?
Got it. Yes. So, anyone who's looking for advice, anyone who is looking for any kind of mentorship or anything that I can do to help them get along in their journey, can reach out to me on LinkedIn. I go by Unmesh Srivastava and I'm CTO for P3 Health Partners. Connect me on LinkedIn, send me a IM, let's get connected. And if there's anything that I can do to help you, I'll be very happy to do that.
As you know, at this point, I open up the platform for you to promote anything that you'd like. You have shared a lot of thought-provoking information, ideas that ought to percolate in my listeners' minds. The platform is yours to promote anything that you would like.
Well, I would just say to all of your listeners that there's no dearth of problems in the technology world to solve for. And there's no better time to be a technologist than today, whatever vertical you are in, because last 10 years has seen big technology disruption. So keep the spirits high, understand the right problems to solve for. Don't start with tech. And in the process of you doing it, just know that it's not a bed of roses. You gotta, there's hustle involved in everything you do. There's no shortcut. So, and in this process, try to find the right mentors. In my personal career, it's been really good. Personally and professionally, I've had great mentors. Try to find people who can help you in your journey. And if I can be of any help, please feel free to reach out to me on LinkedIn and we'll connect, and I'll be very happy to help in whatever capacity I can.
This has been absolutely marvelous. And the whole idea of putting the problem first and keeping that in mind is advice that I probably wish I had known early in my career. Took me a long time to figure that out myself, but you've I think educated all of the listeners immensely. Thank you very much for taking the time today to share with the Software Process and Measurement Cast listeners.
Thank you. Thank you, Tom. It was an absolute pleasure. Very nice to talk to you today.
In Reread Saturday News, it's time for Chapter 5 of Great Big Agile, an OS for Agile Leaders by Jeff Dalton. Link in the show notes. Buy a copy, read along. This week we visit the Performance Circle, crafting. Often state somewhat tongue-in-cheek, this is the part of Agile where all of the stuff that's required to actually create and deliver quality products and services occurs. If I wanted to be even blunter, I might say that this is where the magic happens, where words become something tangible. Remember, buy a copy, link in the show notes. The next Software Process and Measurement Cast, number 634, marks the end of our 14th year. We'll complete year 14 with a discussion with Rick Hall. Rick and I talked about analytics and entrepreneurship. Rick is a successful serial entrepreneur who is happy to share his insights. If process improvement is a never-ending journey, why do so many people ask, are we there yet?